cares? The health department is going to quarantine those kids. So you can debate this mask thing and get nothing done. Not helpful for these parents. Or we can figure a motion, or if anybody else has a great plan that they can propose, I'm up for it, as long as the health department is on board, because they will quarantine. And I don't want to hear people complaining that their kid is quarantined if they were anti-mask. That is totally your right. But don't complain and don't yell at the nurse, which is what's happening every single day. So that's where we're at, okay? So, and I speak for a lot of parents and a lot of staff that aren't here today because they're tired of how bad people have been treated, especially you board members, how people have been treating you. That is not okay. Nobody should be going home crying or being upset and afraid to come in. My goodness, we are adults and our kids are watching us. Thank you.
Okay, thank you. And that concludes public comment, and we'll go on to item 2, COVID update and possible action.
Point of order. Respectfully. Is Jill's resolution an action item for this evening?
Jill's resolution was set aside at the last meeting, so it just comes back. It just comes back as is.
Okay, so it's coming back tonight. I want to thank Dr. Deep for what he did at the 1 hour, 5 minute mark. I was not present because I was in Indiana. And I wrote down what Dr. Deep said. And it was something he had said numerous times about the problem is quarantining. But he wanted to know what the health department's position was before we take a vote. Am I stating that correctly, Dr. Deep? Thank you. The problem is our asymptomatic students are being sent home and quarantined. We need to keep them in school. So as he kept talking, he went back to, will the health department overrule our decisions? And that's the question he once answered. So he made a motion, which was seconded, and it said to postpone the resolution 2 times certain. Okay. So what he was asking for is that the health department would come to and meet with us to explain what our options are. They have chosen not to do so. However, the counsel for the county is here tonight. He will answer those questions for Dr. Deep and the rest of us. Therefore, when you postpone to a time certain, a motion to postpone, according to Robert's Rules of Order, is used to delay an action until a different day, a different meeting, or until after a certain event. Well, that certain event is here tonight. We are going to get our answer. Therefore, because we are going to get our answer, the motion is back on the floor, and Jill's resolution is there for us to have on tonight. It's already listed there. And my suggestion is that we immediately ask questions of the counselor so that he can tell us the position of the county board, the health department, and those are the things we need to know. And then we can make an informed decision as Dr. Deep was asking for.
Okay, Dave, if that was confusing that he's listed as item B, it's not that it's anybody's intention that we would vote on the motion before hearing from him.
And that's fine. It's just that as a board member, if I wanted to ask him a question, and any board member can, I'm just saying that's probably the appropriate time since that motion will be on her.
It is.
Her resolution is on the floor at the beginning of the meeting.
It is.
Thank you.
Yeah. We're just going to, it's COVID update. We're just going to start. Dr. McKenna couldn't be here tonight. We're going to read his letter, and then we're going to go on to Robin Stowe.
And the reason this letter was not uploaded is because it was just sent prior to the meeting. However, board members have it in email. From Dr. McKenna, Medical Advisor, Unified School District of Antigo. I will not be attending this evening's meeting.
Can you guys hear Julie?
It is. I'll move it closer. I will not be attending this evening's meeting. I do not wish to be associated with another sorry spectacle like the October 3rd meeting. No person should have to put up with such abuse. People in the crowd were mean, bullying, and disruptive of the democratic process. The allowance of such behavior diminishes all of us, and I would ask the board to exercise their right to maintain decorum and civil conduct in the future. I also am not attending because I believe that board has the necessary information to make their decision if the democratic process is allowed to go forward. Current COVID case burden in the county is critically high, meaning both the number of cases and the trajectory of future cases is increasing. Hospital resources are currently being stretched thin at this time. My recommendation is to adopt universal masking until cases in the community decline. Such a requirement will be temporary. It will help us protect vulnerable students and staff. Adoption of the October 3rd special meeting motion will guarantee that more students will remain in school. Data from other schools in the state, including the Green Bay District, demonstrates this to be true. Regarding the resolution proposed by Jill Maddock Nelson at the special meeting, it was put forth without any input or advice from medical advisors and does not conform to any current local, state, or federal standard. It attempts to remove close contact quarantine guidelines, which you have no jurisdiction over, and it would be worse than our current policy. Certainly the board may spend its time debating the points of this document, but your time would be better spent elsewhere. If you have questions, further concerns, I'm happy to address them at future meetings or via email or via phone. Thank you for your service on the Board of Education during these challenging times. Please do your best to look past the noise and distractions and do what is best for our students, their health, and their educations. Sincerely, Patrick McKenna.
Okay. So I think we'll go on to you, Robin, as we're all waiting to hear some legal advice.
Okay. Before this meeting, I did send or email a letter to Dr. Sprague. And Doctor, I don't know if you received that letter. It was probably 2 or 3 hours before the meeting tonight. But essentially, this letter can be shared with the public, and it represents really a position statement of Langley County. It's titled Enforcement of Isolation or Quarantine Orders Issued by the Langley County Health Department. And I'm not going to read it. It's there, and if you want to share it with the public, you can do that. The position statement from Langley County is based on guidance provided by the Wisconsin Counties Association, and I did forward electronic copies of this to you, Dr. Sprague, as well. But I can leave these for the benefit of the board. The one document is rather comprehensive, but because of the confusion that really existed after the Wisconsin Supreme Court decision, the Palm decision, the Wisconsin Counties Association partnered with a number of healthcare providers and other stakeholders to provide this guidance to local health departments and local health officers, and it's very comprehensive. So again, as I say, the position statement of Langley County is consistent with the guidance that you'll find in the WCA material, and there's also then a supplement that they released back in October of 2020. Essentially, well, let me just take one step back, and that is county health departments will continue to do contact tracing, and they'll continue to do that to appropriate standards. Many county health departments are already struggling with the requirements for contact tracing, and this is nothing new. Some of you probably know this. Contact tracing is nothing new to COVID-19. This is a requirement that's existed for a great deal of time for all county health departments, local health officers, to trace communicable disease, the spread of communicable disease in the community. So they have to do that. They will continue to do that. They will try to partner with other entities such as the school district with an MOU and other vehicles to try to perform those responsibilities for contact tracing. If partners will not conduct or fully conduct contact tracing, that responsibility will fall back on to the health department. So they're going to continue to do, to the best of their ability, contact tracing. It's imperfect. As some of you well know, sometimes the person doesn't pick up the phone, they don't answer that text, they don't answer that call, they don't provide all the information that the contact tracers need. But we're going to continue to do that, regardless. The other thing that the health department has to continue to do is promote the CDC and DHS guidance. So when you reach out to the health department, and I know maybe you're looking at this, the most recent document that was provided by the director, it might be somewhat confusing to you. It's because they will continue to message, please follow the guidance. Please follow the CDC and DHS and other relevant guidance, OSHA. There's some things from OSHA out there now. So that's what I lead off with. And I know then the question has been presented, if we have establishments, including school districts, schools in Langley County, that are not following that guidance, are not following to the letter the information that's provided by contact tracers, what would the county do about that? What would the health department do about it? And referencing again back to these guidance documents, there's really two types, and when I say orders, sometimes these orders are really advisory, sometimes they're directives. So as far as orders and being mandatory, I can get to that in a moment. But in these guidance documents, they really, and there's, if you look at Chapter 252 and DHS Chapter, the Administrative Code 145, it is clear that by statute, these statutes and administrative regulations do confer a great deal of authority onto the local health officer. But what's not clear and had to really be better defined is what process makes that authority enforceable. And that's when you get into these guidance documents. So I'm not going to go through the list of all the things that the local health officer can do under those chapters for communicable diseases. But I'll break them into really two types. One are general orders. For example, if the local health officer today or tomorrow said we all have to wear masks. In Langley County, I'm telling you, that's not enforceable. And it's not enforceable unless there's a current existing federal or state mandate that they can use as a foundation to enforce that, or if the county has an ordinance. Now, you do have some counties out there, municipalities that have communicable disease ordinances. Langley County does not. We do not have an ordinance. This has been discussed at certain levels at county government with the county board, and I can tell you, and I put it in my letter, there are no plans, there are no current plans to adopt an ordinance. There simply is not. But as I led off with before, you will continue to hear from the health department, please do these things. Everyone, please do these things. But if you don't do those things, if you're asking yourself, what can the health department do about it? As I indicated, general orders, right now, there's no process in Langley County. They're not enforceable. It's guidance, it's advice, it's advisory. The other type of directive or order that could be issued are individual. So individual, we're talking about now there's contact tracing involved. This individual needs to quarantine or isolate, and they're refusing to do that. And again, I'm not going to get in all the details, but there's a process that could be utilized, which essentially is the local health officer petitioning the court, and so there's due process steps involved in this, to then have the court potentially order that person or individual into quarantine or isolation. Right now, we currently do not have a plan or process to do that. Okay? So if what the school board is asking yourself is that you're considering relaxing the standards that are out there right now, the guidance that's being promoted by the health department, I guess as clear as I can say it, Lake County is not going to be a barrier in any way to you considering something else. We are not promoting that. We're not encouraging it. We're not suggesting it. You will continue to hear time and time again from the health department to follow the CDC and DHS guidance. So if you do something different, don't be surprised that contact tracing is going to continue. There's probably going to be even more confusion out there then, that if Lake County is doing the contact tracing to the best of their ability, contacting that parent, your child has to quarantine, and the school, they check with the school, oh no, that child can come back with a mask or whatever that looks like. Likely going to be some confusion there, but your proposal or your protocol to allow for that, Lake County is not going to prevent that. But as I said, you're going to continue to hear that strong message from us that it's not consistent with the guidance. We would prefer that everyone in Lake County follow the guidance. And from my observation, there's a lot of different establishments, a lot of different organizations, groups, even individuals that are obviously doing things differently. Okay? There's not a lot of consistency out there. Repeating myself now, but the health department, you're going to continue to hear them on message. I know the CDC guidance and DHS guidance, that can change over time. It has changed over time. But whatever that current guidance is, that's the message they're going to keep pushing out. And they're going to keep doing contact tracing. So I hope this helps clarify things for you, the school board. But I'll try to take any questions that you may have that are consistent with the substance of my letter. Thank you.
So to clarify then, if this resolution were to pass, Mr. Stowe, there would be no recourse from the county level?
There would be no ramifications from the county. We would not file for any type of injunctive relief. I know there's been other attempts with other municipalities in the state of Wisconsin and other counties, even close by neighboring counties. I'm not familiar with the different regulations they may have already in place that might help support that as a foundation to prop up those arguments. But as clearly as I can tell you, along with the guidance document, we do not have the structure or process in place to enforce these orders at this time. This guidance document does go into great detail on how we could do that. But as I said, as I'm sitting here today, we do not have that structure or process. The health department will continue to recommend that we all follow CDC DHS guidelines, but to the extent that some establishment deviates from that, Lake County is not going to swoop in and take some type of legal action. As I said, at this time, we don't have any of that structure or process in place.
Thank you.
So Robin, what is the potential for legal action at the state or federal level here? I have this article from the Washington Post about the federal cases that are being brought.
So I'm here. I can only speak on behalf of Lake County government, my client, and hopefully I made that clear. I don't represent the school district. I'm not here to give you legal advice. I would assume you have your own legal counsel. But yes, the answer to the $64,000 or $64 million question are all the lawsuits that will be happening against different workplaces, schools, government, public settings, with individuals claiming that they contracted COVID because different protocols were not being followed. Is there risk to any establishment? Well, yes, as you can see in the news, it seems like with each passing day, someone's filing a lawsuit related to whether that establishment or entity is following the CDC guidelines. So,
Okay, yeah. Any other questions for Robin?
Robin, can you just hang around a little after we debate this so we can talk to you some more?
In
absolutely.
case we have more questions, is that what
Yeah.
you're saying?
I feel like we got to talk to each other first.
Yes, absolutely. I'll stick around as long as you need me to.
So
I guess I will say, because I wasn't here and wasn't able to talk last time, we're already made a decision as a school board, I believe 2 meetings ago. Mr. Schrader made a motion, and then it was amended by President Mary, and we decided as a school district, I voted no, but we made a decision, and when we make a decision, you follow it. And our decision was, the majority of the board at that time said we were going to have 2%, and if we hit 2% for our staff and students combined, we would go to masks until it dropped to 1%. That's our current status. So we're already not following CDC. We're doing what we thought was best, the majority of the board thought was best for our district. And so I'm willing to, of course, follow that because that's what we're supposed to do. However, the issue has become quarantining. And Dr. Deep said numerous times at the last meeting that we needed to come up with a plan for quarantining because we need to have our kids in school. And Jill's resolution states basically what I said at a meeting 2 times ago, which was, I'm not in favor of masks, but if we are willing to state that students who are found to have COVID, yes, they're quarantined. Students who are a point of contact, we go back to the parents. We want them in school, all of us. All our teachers want them in school. Our administration wants them in school. And all we're asking is that those kids who are contact traced, their parents can make a decision. They can either keep them at home during the quarantine time, or we place a mask on them so that they can come back to school. And then it becomes very simple. If the kid refuses to wear the mask at school, you send them home. Every day, administration can put out a list to the teachers of any school and say, these are the students who are our point of contact today. They need to wear masks. If they don't wear masks, contact the office. We're already doing our own thing because we thought that a percentage was the best way to go of our students and staff. That was our decision. That's in effect right now. And all we're asking, let's keep our kids in school. So I'm asking you to vote yes on Jill's resolution.
Dr. Bardo, I would disagree with that on one thing. Why would you like to put masks on them after they've already been exposed? Okay, if you know the time period where you can spread the infection to other people, it's 2 days before you're diagnosed or before you are symptomatic. So these children who are unmasked have already spread it to other people, if they have it.
So are you asking that they stay home then and be quarantined?
No.
Well, then we have to come up with a system that we can all 9 or 5 of us can agree to.
Absolutely. And
that's where we're at, and that's what our people are asking for, is to solve the quarantine issue.
right? And that's what I've been asking for all along is we need to change the quarantine. So you're okay with the kids wearing their masks afterwards. So why can't we have them wear the mask before? We are asking for those 10 days that all the close contacts are going to wear masks. You're not saying that they can return without masks. But if you wore the mask, then you would not have to quarantine them.
And I looked at it as a compromise. I said straight up, I'm anti-mask. And I truly believe that parents, I'm not sure if this is on now, parents should decide if they want to keep their child at home, but if they are willing to put a mask on them, send them back. We want to keep them in school. All of us do. We have to come up with a plan to keep them in school. I hear from our administrators, it's the worst thing going on. I hear it from teachers. I hear it more from parents who are staying home, especially with elementary kids, costing them money because they aren't working. We need a solution. And right now we have a 2%, 1%. That's our solution right now for when we go to masks, unless you want to move the goalposts.
No, I'm not going to move the goalposts with the numbers. I would much rather, at this time, I'd like to propose a substitute resolution in place of what we have. I would like to make a motion that the Unified School District of Antigo Board of Education require masks of all individuals in the schools, and that all asymptomatic close contacts of COVID-19/SARS-CoV-2 be allowed to return to school without quarantine at home and continue to mask and be tested with a rapid antigen test if available in the school district at 3 to 5 days post-exposure. Any symptomatic contacts and any individual who tests positive should follow the quarantine per the CDC, Wisconsin DHS, and local public health authorities guidelines. I'd like these requirements to be in place until December 22nd, 2021. Any household contacts which is not within our purview would be subject to the same quarantine that the public health authorities would do otherwise.
Dr. Deep, I just got to ask, was that last part of your motion?
Yes. Okay. Because that is something not in our purview. That would be something if you are the child of or a sibling of somebody who is documented as a household contact, we have no authority on that. That would be up to the recommendations of the public health authorities.
Okay. So Dr. Deep has made a motion to have a substitute motion to the original motion, which is really just amending the original motion. But we don't have a second.
I'll second it.
Okay.
Can I have a copy of that motion? That's a lot to wrap your mind around.
That is a lot.
Can I ask a question?
We have copies for everybody?
Now that we have two motions.
Might have a few.
Let's just take a minute until
Pass it.
Dr. Deep has a chance to hand these out. Make sure Mary Kay gets one.
Thank you.
Thank you.
Give it to Mary Kay when you got, okay.
Dr. Deep, to respond to your question about why masking after identified as a close contact, I think one of the big things within our county is that masks are not recommended in other places in which our student population goes in high volume. And so it's, what's the effect of the mask? And I shared this last time too. If a student's masked in school, but then congregates as large groups at another facility where masks are optional, how do you differentiate if that's stopping a spread or not? And I think that would be it's common feedback from parents as well. So that's my response to why mask after the close contact.
Well, here's the whole thing. If they are exposed at other places, if they come in wearing masks on the school properties, they are still not spreading it. When you wear a mask, you are still the droplets. It's not just the virus that goes out. It is part of the secretions, the droplets. Those things are trapped in your mask. So that's what you're protecting. So even if I were to be exposed to somebody outside, when I'm in the school, if I'm wearing the mask, I'm protecting the people around me. I'm not spreading it to them. If two people are masked, the chances of transmission goes down.
How often are these masks supposed to be changed?
Whenever they're soiled, or
Every hour, every 2 hours, every 8 hours? I don't know.
I can just answer that from talking with one of the elementary principals last year. She said they go through several masks a day. It depends on what they're doing.
Dr. Deep, would this only be indoors?
yes.
So then this would also include if we have any sporting events and visitors are coming into our building, they have to be masked as well?
To include sports like basketball and wrestling.
Anything that's indoors, not our athletes, if they're playing with those, that's a difficult situation for them. But for the visitors, for those who are in our premises, indoors, yes.
Do we, I don't know if Mr. Schofield is here, but do we follow WIA recommendations for actual sporting events?
We do.
And what is WIAA's recommendation right now? They don't wear masks.
We're between or close to being between fall and winter sports. So I know like outdoors, you're right, nobody was wearing a mask. Indoors, I'm thinking, do we volleyball?
Wait a minute, we have volleyball this fall. Yeah.
Right. I don't think Tom is here either. It's been a while since I looked at the WIA guidelines, so we'd have to revisit that, see what they currently say.
Well, I can tell you it was a student's choice whether they wanted to wear a mask at volleyball games, because I attended some.
I got some information from Darlene Jansen, our nurse, over the weekend. I asked her for it. Currently, we have about over 150 students in our district who have a history of asthma, diabetes, things that could indicate that a child's immune system is compromised. Darlene, can I ask you questions? Got a minute?
Oh, poor Darlene.
Sure. Okay, go ahead.
Have these parents reached out to you, the parents of these children whose immune systems could be compromised, and asked?
Some have reached out to me. There are currently 6 children who are not currently in the district now and that are homebound. But 3 of them are super seniors. All of them have health issues. And when they reached out to me, because we are open to everyone this year, it was my recommendation that they talk to their doctor. If their doctor felt that they should not be in school, they should get a note. We have a note from each physician stating that it is unsafe for them to be in school at this point because of COVID. In fact, I did receive one today as well from a student who is severely immunocompromised because of a medication that he has to get on a daily basis. And they recommended he not attend school.
Have these parents said anything to you about masking policy the school has?
If there were 1 or 2 of the families who were concerned about the no masking,
Okay.
and that was the reason they contacted me.
Okay. So we have over 150 students whose immune systems could be compromised to the point where they're more susceptible to COVID. That about
Well, we have I think it's like 8 of our district, I believe. Most of them have a history or have active asthma. And we do have some diabetics. And we have one child who is a diabetic. The mom chose to put her in RVA because of the no masking. Did not want her here because one of the things they have found with COVID is it does attack or can cause kidney issues. That mom chose to keep their child home.
Okay. All right, thanks. I just, we're talking about athletes and everything, but we have over 150 children who have immune systems that are not what they should be, and I think in consideration of them, I think that we have to look at the masking policy. I would support Dr. Deep's motion, simply based on the number of students we have who could be compromised. We hear percentages of low numbers, survival rate and all of that, but if you've got a child who is immunocompromised, I wouldn't want my child to be exposed. I wouldn't want them to take a chance on getting COVID.
Okay.
Thank you.
Anybody else have questions, comments?
I think we've received a lot of feedback from parents that have students that struggle wearing a mask and do not have an IEP and do not have other diagnosed illnesses or chronic health concerns and struggle wearing a mask. I think that's a concern that we don't talk about. And I think that the academic achievement component of masking impacts notably the younger grades because of their inability to see their teacher's lips and pronunciation, and the teacher to also see the students' facial expressions and lips and pronunciation, social skill development, nonverbal skills. Those are the things that are impacted by the mask. So when I share my feedback, I'm looking at this from a well-rounded perspective of how does this impact students and their achievement and their struggles. It's not to minimize safety risk or concerns, but how does this impact us as a district with student achievement? And I do think there are impacts to student achievement from required masking, especially with the younger kids.
I was at All Saints last year, half a day a week. I was our guidance counselor. And it seemed like there was very little issue getting kids to wear masks. I don't remember any issues with kids not wearing masks. And we all want our kids back in school. We want all kids back in school. And if we can make that happen quicker by masking and taking this thing down, I think that would be the way to go. I'm concerned about student achievement too. We all are. But I think the health of our children is important too. And again, going back to those students who are immunocompromised, there's over 150 of them in our district. Their parents have some serious concerns.
Dr. Deep, so with your motion, so if everybody's wearing a mask and somebody's a close contact,
They will not be quarantined.
They will not be quarantined.
I did verify that with public health.
okay?
If you looked at the CDC, and I don't have copies of this, I have only one. Close contact through proximity and duration of exposure. Someone who was less than 6 feet away from infected person, lab confirmed or a clinical diagnosis for a cumulative total of 15 minutes or more over a 24-hour period. For example, 3 individual 5-minute exposures for a total of 15 minutes. An infected person can spread SARS-CoV-2 starting from 2 days before they have symptoms, or for asymptomatic patients 2 days before the positive specimen collection date until they meet the criteria for ending isolation. Exception: in the K-12 indoor classroom setting or a structured outdoor setting where mask use can be observed, the close contact definition excludes students who were between 3 to 6 feet of an infected student, lab confirmed or a clinical diagnosis, if both the infected student and the exposed students correctly and consistently wore well-fitting masks the entire time. So I quoted this with the public health authorities and I asked them if we required masks, would they allow us this option to less than 3 feet? And they said yes. So this is the compromise that I'm offering.
I have one more question too. So if this passed, could we have an exemption waiver for students who have IEPs or any other reason their doctor says they shouldn't wear one in place? I know other school districts do.
That's up to the board to decide. That's not my opinion.
I believe
And
that's
we've
already.
always allowed a different type. You know, we work until we find something that works for each child. I don't know, Heidi or Dar, do we have any medical exemptions?
We don't have any medical exemptions. However, if there was, all we need is a note from their physician, and then they are able to go without a mask as long as we have a medical exception on file. Last year, we did not have any, and they were given those options.
I would caution to say kids seem to wear masks well. I've talked to many kids and many parents, and that presentation is more than what you see on the surface. There are many struggles for many kids wearing a mask. So I'm not going to go on about that. I just caution that to generalize a visual observation to state that kids wear masks just fine, I don't think is accurate nor fair to generalize. So I just caution that. Dr. Deep, can you share a little bit more about the component of your motion with testing?
What do you mean?
Can you just help me understand if testing would be required at 3 to 5 days post-exposure to can you clarify that a little bit further for me?
Well, if you are looking at anybody 3 to 5 days post-exposure, that's when the virus load is enough for a test to turn positive. So this is for your contact tracing and to make sure that somebody, if they are positive, that is the time frame that you check the test. If they are positive, then you can follow through with further contact tracing, or if they become symptomatic, then they would have to go through the quarantine requirements per the DHS or CDC or local public health authorities.
So it wouldn't be testing required for close contacts, only if they.
If you are a close contact of a positive case, you can go get tested at 3 to 5 days, so that the parent can rest assured that their kid did not get it or they got it, and they can follow the appropriate precautions or monitor their child.
So I think what Jill.
So I'm just asking, yes, so a parent can get them tested. I'm just making sure that, because I think parents would want to make sure this is really clear on our end. This isn't saying a student would have to get tested. It would just simply say you're following.
Yes, it would be nice to have that option. And Darlene, do we have that up and ready now? Last time you said that you were still in the process of getting it.
Yes, I finalized the very last question I had. Today was how do I get notified when a parent registers their child. The process that we have to go through with this test is that parents will have to register their child online. Once they get registered, they get a QR code. They come into and then I get notified of the registration by email from the lab. Once I get notified, I will contact the parent. We will schedule a test, and then they need to bring their QR code, and then once I collect the sample, I just link up a couple of codes. And it goes really fast. Oh, I'm sorry.
Is antigen testing a swab or can you spit?
Swabs.
Swab.
Both of them are swabs. It's not the brain tickle one. It's not where they put it back into the nasopharynx. It's just up to about mid-nose. And that's for both of them. We do have the antigen test for the asymptomatic close contacts, and we also have the PCRs for the symptomatic people. We will not test anyone without a parent permission. Again, for the kids and the people under the age of 18, parents have to register online in order for me to do the swab. And then when they present to the school for their child to get swabbed, they have to come along with the child. And then we will also have them sign another paper copy that the DPI had sent us for each school district to use. So yes, we do, and I think our target date to be up and running is next week. I have done just one practice with one of our staff. So, and it's really slick the way that the antigen test goes.
And if I remember correctly, you also said that any parent or close contacts, household contacts could also get tested if they prefer to do that?
Anybody, they made it so it's almost anybody can get tested at the school. It can be a grandparent, it can be a neighbor who comes to pick up the child, it can be any relative. They've made it extremely easy for anyone to come to the school to get tested.
Thank you. And Jill, that's the reason that I wanted to offer that testing is maybe the kids are not going to get as sick, but you might have an older relative living with you or close contact, or maybe there's somebody at home. And yes, when you go home, I don't wear a mask in my house. But if there was somebody at home that these children who were exposed to somebody at school could potentially take home, it's a point of confidence for the family to know that they have the ability, not having to pay for a test, they can have a quick 30-minute or 40-minute turnaround on the test to say, yeah, my kid was exposed to Danny or Wayne, and now I just had him tested and he's negative at 5 days. So yes, he can go visit grandma this weekend.
Yep, and I respect that and I appreciate that. I just wanted to clarify.
If we tried to bridge this, if we tried to bridge the gap some more, Dr. Deep and Jill and Dave, what if we did Jill's motion and wore the masks, but then required the test? Instead of requiring everyone to, you know what I mean? You're wearing the non-symptomatic close contacts are wearing it, but you take this antigen test in 3 days. And if you do that, then you can come back.
I don't think.
I do not want the quarantine.
Right. But then everyone would have to mask in advance.
Right.
So you don't want that, and Jill doesn't want to test.
I didn't
or
say
wear
I didn't want to
masks.
test. I asked to clarify if it was a parent can choose or.
No,
So
yes,
has-
a parent,
I was just
yes,
clarifying.
your parent can choose to have them wear a mask and test, or they stay home. But they could stay for those, I don't know, we'd have to work it out. Because you're saying we get this result back in 40 minutes?
Yep. But JD, the whole reason that I brought this up a couple meetings ago was that in the month of September, 975 children in this school district were quarantined for varying different periods of time. There are many who are on reduced or free lunch programs who probably did not have access to meals. You had parents who had to take off from work to be there and take care of their elementary age kids, loss of income, and you also have kids who miss their social interaction at school. They are lagging behind in their studies. It's an additional stress on our teachers that they have to help those children catch up. So this is a compromise that I'm asking for 2 months, that we can concentrate on education of the kids without having to worry about what is going to come at the next meeting. The can's going to be kicked down only for 2 weeks or 4 weeks or until some number comes, because you start talking about community numbers, you start talking about the school numbers. I do not want any numbers. All I'm saying is for a defined period of time, let's have everybody in the school, let's offer them the testing, let's change the quarantine, and public health is on board with this, and come back in December, see where things go. You know, if the numbers are going to dwindle down, I'm happy when someone would make a motion to reconsider at that time at our December meeting, and we can go back to whatever or adopt whatever is possible at that time.
Just two issues.
Yes, sir.
When you verbalized your motion, you said December 22nd, 21. What's on paper says
I have
January
debated about
20th
it. Yeah.
of 22, so you've changed your mind.
I'm looking for at least, yes, if
So you want it to be December?
December 22nd is the last day of school before winter break.
Okay.
Okay, I debated about it. I would prefer to have it
Okay,
through the end of
it's
the
just
semester.
that the paper came in with a different date. So the other thing, and I'm not really probably going to vote for this, but you need to put a start date because
Okay.
no one's coming in tomorrow with masks except the few
I
who
will-
already wear them.
Sure. I
So
will.
you need
I will
a
leave
start
it.
date.
Okay. From an administrative standpoint, when would that be possible?
Monday. That gives us a few days, if this passes, to notify all families of expectations.
October 18 to December 22nd.
What if somebody what?
I'd just like to expand on something Dr. Deep said about children going home to a household where there may be somebody else with a compromised immune system. I think that's something very realistic that we have to look at. Our staff, they're under a lot of stress. The young lady that spoke earlier tonight mentioned how staff is concerned about what's happening. I think we have to consider both of those. Staff, students that go home to a parent or a grandparent or somebody who has a compromised immune system for whatever reason. I think these are all good, valid reasons to mask until we can bring this thing down. We all want our kids back in school. Masks are not perfect, but I think the sooner we get this under control, and masking will help, I think the better off we're all going to be. Parents, students, and staff.
When I looked at the October 3rd motion, I just brought it up and then was comparing it with this one, Dr. Deep. The two differences, we took out, or you took out the 5% for county, which I understand. We did have the caveat in there that says wear a mask when in the presence of others. Would you be comfortable adding that to the motion? So when a teacher is in his or her classroom alone, prepping, let's say, would not have to wear a mask?
Yes.
Okay.
Is there any opportunities during the day where students would have time where they would not be around others and can take a mask off?
We have allowed, well, I go back now to last year, there were mask breaks for kids who, we felt needed them. And then, of course, any outdoor activity and lunch before school, any outside, when they're waiting, but.
Dr. Sprague, what's your feedback on learning gaps for the 4K students last year who were mask required and now will experience extended mask use if this passes? I'm looking at 4K to second grade in terms of JD, you're very focused on phonics, and I've spoken to reading specialists that do identify barriers to learning at those pivotal moments. So do you have any feedback on impacts?
I don't have any evidence of that. However, I feel a bit better about it, Jill, because there's a finite time in the motion. If we were talking until the end of the year like we did last year, I would be hesitant as well. I think for a couple months, especially since most have not been wearing a mask, we would be okay.
Hi, this is Amy, if I can just interject. Shortly, we'll be giving a presentation about our current data from last spring into this fall. We just had our benchmarking period. If you had an opportunity to review that, it actually is very similar from last fall of 2021. This fall, sorry, I forget which year we're in right now. 2021 to last fall 2020, our numbers almost are exactly identical as far as to proficiency, students at risk as a district.
Thank you.
I have one more question. So this is pertaining to COVID, but I have 2 kids in elementary school who, my son's in kindergarten, so he's been sick 3 times already this year. He's gotten 3 COVID tests, all negative. So I don't know if there's anything we can do about that, but that is very frustrating as well. And I don't know, maybe it'll speed up the testing, but with having it able to get them done by Darlene, but can we just list out on our website what reasons we have to keep our kids home from school? I know the health department gave us that shortened version, but I didn't know until I told the school secretary, well, he has a cough, but I feel like as a parent, we need to start trusting parents because they know their kids the best.
Oh, absolutely.
And my kids have been wearing masks, every day, but it doesn't bother them one bit, and they like the different colors and all that, and they can throw them away, and they have extras in their bag. But at what point can we just, start moving past it? I mean, not that I want my kids to go to school and spread a cold or this or that, but keeping them home and out of school, and it's hard because our district is not set up to teach at home. It's just not going to happen.
The problem that we have as right now is with this Delta variant, a runny nose. We have had numerous kids who have just had a runny nose, and they have come back positive. We have had them come to school because they feel that they are allergy related, and they've come back positive. We can't differentiate between is it an allergy or is it COVID. We don't know how to differentiate except for the test. If they do have a family physician that is treating them for allergies, we do have some doctors sending us notes saying, if Jane Doe comes to school and has this symptom or this symptom, please do not exclude them as they are under treatment for allergies. If that's the case, we don't exclude because we have that from a physician. But again, with nasal congestion, the most common symptoms we see, nasal congestion, runny nose, sore throat, and a cough. Those are some of the most common, and what do they, what is similar to those symptoms? It's a common cold or it's allergies. So it makes it really hard. I will say last year I did see a decrease with the masking. We saw a decrease in all of the upper respiratory. And we had no influenza at all last year. So the masking did help decrease the upper respiratory infections that we saw. But it's really hard at this point to differentiate. I wish we could. But it's, like I said, some people just have a runny nose for one day, and then we get a message saying that they're positive. So
Thank you. I've one more question that I'll just slip my mind. Communication. So if once the testing site is up, will this speed up the communication time to parents when, because they're getting a week later, your kid was in close contact, but you've been in school for a week?
Yeah, and the problem with that is what we do have, like if they go to Walgreens, it takes 3 to 5 days for them to get their results if they go to Walgreens. Aspirus, we are seeing less than 24 hours in a lot of cases now. When I do the testing, if it is a PCR, I just have to call Rhinelander. They will come and they will send a courier. It will get delivered to the lab that day, and then they get notified within 24 hours. Once they register online, it automatically goes, the results get sent to the parent. As soon as it's ready, as soon as it's resulted, it gets sent to the parent. Another issue that we've seen is that because parents think, you know, we've had, and rightly so, a lot of kids with allergies, and the parents said it's just allergies and they've waited, but then because the symptoms don't go away, they go and get tested. So then we have a delay in getting the results and notifying. So, you know, I'm hoping we can get it speeded up somewhat, but.
Dr. Deep, with that lapse in time of notification, couldn't you reasonably say that the close contact tracing occurring late, say 4 days, 5 days after, couldn't we reasonably argue that the cases haven't gone up, so the masking as proposed within the resolution is not, you know, like, by not having masking all the time and masking close contact would provide protection because the numbers aren't going up right now, even though there's a delay.
Well,
Can I answer really quick? When you look on the dashboard and you see that the number is maintaining, it doesn't show you how many people are recovered and then how many new cases are added on. Today we had 3 new cases come into the high school, 1 into the middle school. Over the weekend, I had 2 cases to East Elementary and 3 to the high school, but we also had 4 recovered.
Correct.
So it's a constant turnover.
Right.
You're not
so
looking at the cumulative there. You're only looking at a set point in time. So at that point, some drop in, some drop off.
Right. So the current quarantine for close contacts is reactive and late notification, but yet our cases aren't going up is all. So
My whole purpose in this is basically getting rid of the quarantine
Correct.
as current stands and keep the kids in school. So it's pretty simple. Status quo where you require all the quarantining and everything, or we have an option where we could probably keep our kids in school, keep them safe, give them the education, come back in a couple of months, see where we are at. Numbers are down, you could change it. Done.
So what happens procedurally if Dr. Deep's motion is defeated? Is Jill's motion also defeated?
No. Then that comes back.
So right now, are we just voting on whether this motion is going to be amended?
No, we're voting on, Dr. Deep has made a motion
substitute
to
resolution.
amend the entire former motion. And so if his motion were to pass, then we would vote on the original motion, but the original motion would be his motion.
This would become the main motion. If it is defeated, then you go back to the original one from the third.
Okay,
How do we go back to the original one from the third? We didn't even discuss that on the third. We only got through Jill's
He
resolution.
means
That's the one we are talking about.
Jill's,
Yeah.
Jill's
Yes, that's
So
resolution.
this is going to take
Jill's place.
Jill's place.
Right.
Yes.
So if you want to get.
The
to
motion on the third is not on the table at all.
No, I meant Jill's
I got
motion from the third.
I got
Just
you.
trying to play
The
hard.
motion that was listed
you.
in the agenda on the 3rd is not on the table.
Absolutely. Absolutely. I understand.
I'm just going to ask, or maybe I'll just make a motion to amend the motion to add the following words, and that would be from October 18th would go in between effect and through January 20th,
December 22nd,
December 22nd.
2021. And then when in the company of others, when in the presence of others was another word that Julie brought in. Julie, can you tell him where that comes in there, please?
I also was thinking adding indoors, so I make a motion that the Unified School District of Antigo Board of Education require masks for all individuals indoors on school properties when in the presence of others.
But when it comes to WIA sports,
Right, the athletes remain to be seen. Will follow WIAA guidelines.
They go home.
I don't think that we can.
Protocol.
Last year, we had a protocol. We did everything we could to not make it a discipline issue, and we would try that again. It wasn't perfect, but the vast majority of kids would, meet with us and explain what was happening, and we have a significant supply, although we know that there districts like us all across the country are talking about this, so that supply is dwindling. So we would welcome those from home as well, but yes, we'll supply while we can.
Okay, so we have a motion to amend the amendment to put in the words from October 18th through December 22nd, and also to add in the words after the word on, all individuals on, would go the words indoors on school property, and then also when in the presence of others. So is there a second for that motion?
I'll second that.
So now what happens if this motion fails? Are we back to Dr. Deep's?
No, this
No.
is,
this is his.
if this fails, then we're back to his original.
Back to Jill's.
No, back,
Dr. Deeps.
back to this. They just added the.
They're doing an amendment to
Okay.
Dr. Deep's motion.
It'll be Dr. Deeps without this.
Okay.
It's just to put that date in.
Right. But so if it passes, we still have to vote on whether we're accepting it or not after we
Right.
vote. Okay.
Yes.
Right,
Okay.
you're basically making a vote just for the amendments,
Okay.
just those words.
Okay. Is there any further discussion on this second amendment? Then I think we'll do a roll call on it. Mary Kay?
Bardo,
So this is the amendment.
Second
the
amendment.
amendment to the amendment.
Yes.
Deep,
Yes.
Gagnon,
Yes.
Maddock Nelson,
No.
Neufeld,
Yes.
Hyatt,
Yes.
Schrader,
Yes.
Zimmerman,
Yes.
Mary,
Yes. And so now we have the motion to amend the motion. The amendment as it has been amended.
So that's the
Um,
primary.
Is there any further discussion on it?
So one more time, the parent has to require them. They have to take the antigen test.
No.
No,
You're
that's just an
offering-
option.
You're offering them at 3 to 5 days post-exposure. Not just the kids, but all household contacts.
Okay. Mary Kay, would you like to read the motion back to us?
Good luck.
I make a motion that the Unified School District of Antigo Board of Education requires masks for all individuals indoors on school properties when in the presence of others, and that all asymptomatic close contacts of COVID-19 SARS-CoV-2 be allowed to return to school without quarantine at home and continue to mask and be tested with rapid antigen testing if available in the school district at 3 to 5 days post-exposure. Any symptomatic contacts and any individual who tests positive should follow quarantine per CDC, Wisconsin DHS, and local public health authorities guidelines. These requirements would be in effect from Monday, October 18th through December 22nd, 2021. Close contacts and of households based positive cases would have to follow public health quarantine procedures.
Okay.
JD, I want to ask, are you questioning that made to test on the basis upon symptomatic contacts and individual, pardon me, let me go back up. Be tested with rapid antigen testing if available. So if there are tests available and the parent says no, what's the recourse?
No, there's no recourse. You're offering them the test.
Because the way this reads, if it's available, they're going to be tested.
That was my clarifying question earlier
Yeah.
too. Is can.
The way this reads now is
No.
if the tests are available, they will be tested. We should have it parental permission in there.
If available and requested.
I agree. Yeah, that.
Vote on that.
Can't.
Or even just and continue to mask and can be tested. Just be adding the word can. Have the option to be tested, something.
No, I think his point, I understand what he's saying. We're making it clear here in the discussion that testing is not required.
It's clear in our discussion, but is it going to be clear after our discussion?
It will be
Julie,
in the minutes as such.
Julie, what was the word that you just said?
With rapid antigen testing if available and requested.
I'd like to make a
Well,
amendment to the motion
Danny?
to add what Julie just read in there to make this clear for everybody.
okay. Okay, yeah, you can do that.
Second.
So, any further discussion on that?
I just,
amendment?
Andy, I'm sorry, I just think that clarifies, as when Julie said that, it struck a chord, that it brings very much clarity to what's.
Danny, I'm not questioning what you're
Yeah.
doing. What I was
Yeah.
questioning is how many times we can amend here.
All night if we need to, but we won't.
This is,
Oh, 10
this is a new set of
10
amendments
o'clock.
10 o'clock.
you're bringing here, so, yeah. Okay.
Was his amendment seconded?
Mm-hmm.
Okay.
Any further discussion on that? He just really wants to clarify that, and I don't see a problem with that.
Clarification.
Mary Kay, we'll do a roll call.
Deep,
Yes.
Gagnon,
Yes.
Maddock Nelson,
Yes.
Newfeld,
Yes.
Hyatt,
Yes.
Schrader,
Yes.
Zimmerman,
Yes.
Bardo,
Yes.
Mary,
Yes. Now, if you'd read that amended motion back to us one more time.
Don't.
I make a motion that the Unified School District of Antigo Board of Education require masks for all individuals indoors on school properties when in the presence of others, and that all asymptomatic close contacts of COVID-19, SARS-CoV-2 be allowed to return to school without quarantine at home and continue to mask and be tested with rapid antigen testing if available and requested in the school district at 3 to 5 days post-exposure. Any symptomatic contacts and any individual who tests positive should follow quarantine per CDC, Wisconsin DHS, and local public health authorities guidelines. These requirements would be in effect from Monday, October 18th through December 22nd, 2021. Close contacts of household-based positive cases would have to follow public health quarantine procedures.
Okay, any further discussion on this amendment? In Mary Kay, we'll go ahead with a roll call.
Gagnon,
Yes.
Maddock Nelson,
No.
Newfeld,
Yes.
Hyatt,
No.
Schrader,
No.
Zimmerman,
Yes.
Bardo,
No.
Deep,
Yes.
Mary,
Yes. Okay, so we're now at the original motion, which is now Dr. Deep's, it's the motion that Mary Kay just read to us. So if there's any further discussion at this time, we'll go ahead with another roll call vote.
Maddock Nelson,
No.
Newfeld,
Yes.
Hyatt,
No.
Schrader,
No.
Zimmerman,
You can pass, but
Then you'll be last.
yeah, you'll be last.
I'm gonna pass then.
She's passing.
Bartle,
No.
Deep,
Yes.
Gagnon,
Yes.
Mary,
Yes. And now,
Zimmerman,
You can ponder.
Yes.
okay, that motion passes. Do we have any more on the COVID update? No. Then we'll go on to new business, and item A is Wisconsin School Board Week. And I would like to start by saying thank you to all of you who serve on the board. You have something, Julie?
Yes, and here it comes.
Uh-oh, here comes my candy.
on behalf of Jennifer Sprague and I, we worked together with Red Robin Machinery. Cute. And we wanted to present with everyone to show our appreciation for all the hard work you do for the staff, students, and community.
Come up with these clever things. I like to.
It's neat.
Thank you.
Thank you.
Were the best.
Our kids made this?
Our
Julie?
kids made this.
Good moral.
Oh, they're lovely. Good what?
Good moral courage. So those were the Langley County ordinances. How did I look that up?
Thank you.
Oh, yeah, I've got places
Didn't know that
on my
existed.
neck. Okay.
Artistic kids, and that's the whole.
I don't know. There's
I hate it when people write so neatly.
open to.
Thank you.
I'm going to do the same as Mary.
Thank you so much.
I think we're good.
Thank you.
Yes. What happened if the kids don't read?
You know, Dr. Lee, these masks, like most of these are wearing, when you're working in a medical profession, they have to be changed every so many hours because they're ineffective. Okay, you're gonna make sure all these students change their masks, and are you going to provide them? They are not safe, they are no good after, you know that.
So we're still in the meeting, and
Now, who's gonna provide all their masks and make sure that children are, they're
the school district is providing masks. I hope. Okay, we're going on with item B, board member meeting and legislative report. Does anybody have anything they would like to report on? No. Okay, I'm just going to say that there's
Dave and Jill left. Should we take them?
Mary.
Walked out. They're at
Three of them.
They just went to the restroom.
okay.
You just keep going.
Well, we'll take a break.
A 5-minute break, maybe?
5-minute break. Okay, we'll continue on with the meeting. We're on
Item C.
B, under
item B. We're still on board member meeting and legislative report. I'll just say that there's, what is it? It's a legislative thing on, I think it's November 3rd. Is that correct?
3rd or 4th, yes.
Yep.
I know the date.
And where they just talk about legislative issues. And I think that's in Stevens Point, if anybody's interested. And that's
November 6th.
November 6th, okay. Well, you can contact Mary Kay if you're interested. Okay, and then we'll go on to item C, beginning of the year data and continuous improvement plan.
Good evening. I think this is on, yes? Okay. Hello, everyone. I will be inviting our other administrators to come on up as well to share in this presentation with me. So in continuation of our promises last spring of bringing data to you after our 3 benchmarking periods, spring and then fall and winter, we'll be sharing with you not only student benchmarking data, but also data correlated to our continuous improvement plan. I know you had an opportunity to review the presentation shared with you on Friday. There were some slight modifications, which we'll share with you, were more for consistency's sake and hopeful understanding throughout the presentation. We tried to make it as streamlined as possible. All right. So whenever we meet in our teams, we always have some community engagements, some community commitments that we engage in as we look through data, have tough conversations, challenge one another. So I would just invite you to join us today. Certified staff being a key word, it doesn't include support staff. So this is ranked in order in our CISA 9 by low economic status. So you can see Annie goes kind of near the top in our area of how many of our students and families qualify for that free and reduced lunch programming. So in the past, we brought you our continuous improvement plan, and we have 3 goals that we're going to share data with you. In the past, we haven't had data to consistently show for some of our goals because we hadn't done a second survey with our staff and we hadn't had some updates. We've brought you a lot of academic data in the past, but we'll be able to show you some school conditions and leadership data today in alignment with our continuous improvement plan. I'm not going to read these to you because I don't think that that's helpful, but when we get to each section, we'll reiterate the goal at that time. So something that's very exciting and a lot of work was this spring and then into the summer, we not only collected a lot of data sources, but we then put it into a continuous improvement plan where we tweaked some of our measurable outcomes, our ICANN statements for our staff and our administration, and updated some of our supports and services we wanted to have to plan for this year. From that, then we had each school have a leadership team where they then created and aligned school improvement plans that fed into our district improvement plan to support and align with the work that we're doing. We haven't had that type of system before this summer, and we engaged in a full day of learning with our staff leadership team to help develop and evolve that. And our administrators have done a great job of bringing it back to their staff, getting input, making slight tweaks, and now they're living their school improvement plan within their building and in their staff meetings. And it's in alignment with our district plan. So we're starting to really streamline not only the work we're doing, but the funds that we're using and how we're purchasing, providing professional development. It's all aligned now, and they feed into one another. If you want to even take it another level further, a lot of our teachers are writing their goals for this year to feed into their school improvement plan then too. So that goes right down into the student level data then too. So we're really trying to create a system of improvement and not have any of our schools working in isolation, but really trying to work towards the same goals. So the first data, which we'll report on, which will be the majority of our data because that's where we have the most sources, is our academic goal. So as you can see, this is longitudinal for a few more years, but by August 2024, we would want to meet or exceed the state's percentage of students scoring proficient on the following state assessments. And you'll see some of this data here today. Board exam, ACT Aspire, and ACT in the areas of reading and math. Currently, forward exam data is still embargoed, so we're not able to share that with you today, but hopefully by winter we'll be able to. We will share with you some ACT Aspire and ACT data, and also Fast Bridge benchmarking data, which is in our district 3 times a year.
Amy?
Yeah.
What's the difference between the ACT Aspire and the ACT in the areas of reading and math?
Great question. ACT Aspire is what our 9th and 10th grade students take. It's a standardized test in the spring, whereas the ACT is the standard 11th grade assessment that is typically used for college entrance applications. And however, the big change with ACT now is that all students take that. It used to be where only students elected to take it or chose to take it if they wanted to. Now all students take the ACT as an 11th grader.
But hasn't that impacted our scores though, because you started having everybody do it?
Yep, and that's correct. Dr. Deep was saying, did that impact the overall scoring? It absolutely did. We saw it not only as a state, but as our school district. We saw a decrease in the overall score, but that was commiserate with what we saw at the state as well.
Why do they embargo the state? Why do they do that for the exam?
Why do they embargo data? It's to ensure that all stakeholders have had a chance to review the data and I think to really ensure the validity of it before it's shared out. I've never asked them, but I would make some assumptions. All right, so we're going to talk about FastBridge a little bit. You've heard of it before. If you're new to the board, this is a new slide for you. It's a benchmarking system. We always try to triangulate data. So yes, we look at this and do make some decisions, but it's always in alignment with some other measurements we're doing. Classroom assessments, teacher noticing of what the students are or not able to do. It's one piece of evidence. I wanted to share with you some district overall scores, and Jill, when you asked the question earlier, this is what I was alluding to. So here you can see K1 and then 2 through 11. The reason these are split out is because our K and 1 students actually take some tests at a much faster clip. At those grade levels, they're learning a lot more foundational skills, not only in reading but math, and their tests kind of adjust pretty quickly to keep up with their rapid pace of learning. And they don't have an opportunity to score in a college pathway at K and 1. At 2 through 11, you can see the overall proficiency. And on the left, please pay attention that bar graph only goes up to 50. So each line is 10, not something different than that. So I was curious about looking back at last fall to see how maybe different or similar we were. Our scores for district benchmarks in reading were almost identical. And when I say identical, there's 1 point of difference between low risk and college pathway. So our scores are pretty consistent between last year and this year. with our fall scores for reading.
Is this our third year of FastBridge? Or how many years have we been doing this one?
This is our third year of FastBridge. Yep. Another look at this is for district math. Now this one actually has a celebration here. Last year when we tested in the fall, we actually had more students in the at-risk area. We moved 5 percentage points of students actually out of high risk as a district into actually it was the low risk area. So that's significant. So that means, I'm going to guess, that means that some students who were in the some risk area moved into low risk, and then some of our some risk moved into low risk. Is that what I just said? Sorry. Okay. So that's an area of celebration because that's 1 year we made a 5% impact on the students. So that's exciting. A couple of things I also want to share. In the past, we only assessed K through 9. This year we started assessing consistently our 10th and 11th graders as well. So that's some new data. We're trying to become more systematic, even with the data we're collecting for all of our students. There's the potential to even test 12th graders in the future if we feel like that's important to continue to see their growth. And right now we're showing you all proficiency scores. So in the future, presentations will not only show you areas of proficiency, but then growth scores to show how much our students are growing and at what pace they're growing throughout the year. All right, so I am going to pass it on to Clint, who's going to start focusing on our secondary academic data.
All right, we're going to kick it off with some FastBridge data. So we're going to look at A reading and A math, which are two of the tests that our students take. And when I calculated this, I put in some percentages here below that. That is the percentage of students that are combined in low risk and college pathway categories, because that's what we're aiming for. That's what we want. So we're going to be, our school improvement plan is talking about moving students from the low risk or the high risk and some risk into the low risk and college pathway categories as the year progresses. So we do FastBridge 3 times. We'll see how we're doing in the winter and our final in the spring. So this is math, again, with the same percentages below. Again, that percentages in low risk and college pathway categories. So keep in mind that when you look at this data and you see 8th, 9th, 10th, 11th, those are different student groups. So it's not continuous in that. It's just separate student groups that we're going to be tracking throughout the year.
Do you by any chance have those numbers for last year for comparison on this one?
Yeah, we can. We just need to dig them up.
Okay.
Yep. So our ACT score last year, you saw this last spring. The state was at 19.2 this year, and last year the state was at 19.9. And I just point that out because it's significant that last year the state was at 19.9. Like I said, we were at 17.8, so we had a pretty big gap. We went up 0.2 points. The state actually went down 0.7 points to 19.2. So that's just significant. That means we didn't, according to that test and that student group, we didn't sustain the drop that the state did. We actually increased a little bit.
Can you see, like, do we end up with some scores that are like 6? Like, somebody doesn't try at all. How many do we, does that, do they exclude that from the average, or do they?
No, that's all of that stuff is in there, but it's in there for all
Everyone.
schools.
Yeah.
Not
okay.
just us.
But so you don't know. I mean, do you know, like, 10 kids didn't try at all, or we don't know?
They're still included in the score.
Okay, I just was curious if.
Yep. So on this slide here, this means A is Anago and S is state. So again, this is a breakdown of our 1920 ACT scores, our 2021 ACT scores, and the state's just their 2021 ACT scores. But what this does is it's not the composite. It breaks it down into the different categories. So the 3.2 is advanced. Then we've got proficient, basic, below basic, and then this is the percentage of students that did not test.
What is advanced and proficient? What's the score? you remember? Is it like 32 is proficient or something, or is it?
I don't know how they do that.
I don't know that either.
The reason that DPI started doing this graph is because if you look at forward exam, there was never commiserate scoring between forward exam and ACT. They were on very different trajectories. ACT is like a 25. Well, what does that mean when you have a forward exam score? And this is how they would always report forward exam. So this is the state's attempt to make some consistency in how school districts can see their growth with like a student cohort, like Dr. Deep was saying.
So we've got math on the left and ELA at the right, but what I want to direct your attention to is in our advanced and our proficient categories, we're growing those. It wasn't a huge growth, but it was growth. The same thing over in ELA. We didn't have any students score in the advanced category in the 2019-20 school year, but in the 2020-2021 school year, we had 1.9, and our proficient also increased.
And this is in spite of the pandemic.
Yes. So here's some more data on the advanced and proficient. So we added those two together. So in 2019-2020 and 2021, those are the ACT scores. So we did increase in percentage. So we added those percentages together for advanced and proficient. So on that last slide, we took the top two colors. And then that's our reading, and our math had a little bit of growth, but not as much as the reading.
What's the third subject in ACT? Isn't there 3 parts to it?
Science?
There are more. There's a breakdown: math, science. The 10th grade has social studies to it, and there's also an English component.
ACT you're talking about, right?
Yes. Yep.
So we are not comparing the science with the state or the previous years. So it's only the math and the.
We just broke down the math and ELA here.
And the reason we did that is because that aligns with the goal of the district. We could pull that though and share that, but we're trying to update our continuous improvement plan.
And we had to prioritize how much
Sure.
data we shared, because we could be here all night. So.
Danny wanted to.
Yeah. Then the last comparison at the secondary level here is the ACT Aspire, which is again our 9th and 10th graders. That's what they take, and you can see the breakdown. We don't have the 1920 data because we did not take the Aspire. That was the whole shutdown year. But next year we will have that comparison data for you. So what questions do you have about FastBridge or ACT at the high school?
Well, it's encouraging to see that the numbers are going up. So we probably still need to keep building on this.
Absolutely.
When you looked at the data from the other areas that we're not seeing here, was there increase in those areas, or what did that look like, just basic overall?
Like
In the science and the English?
I didn't break it down to that level.
You didn't look at to see where, okay.
I mean, I looked at it,
It was a lot.
but I didn't break it down to that level, so I'm not going to speak to that, but we could definitely pull those.
One thing that was pretty consistent though, we're pretty fortunate as a district that we were in person for 4 days a week, because you can see that the state has a much higher percentage of students who aren't testing. So there's a lot of question marks as far as to when students start coming back more, where they'll fall into their proficiency category. So we had a lot of students testing and very good testing rates.
Hello. So we have our FastBridge data, but that's pretty much all we have right now. We don't have all this other stuff. So Clint pretty much went through the ACT, et cetera, but we also have the FastBridge A reading. And so we are quantified this fall. We started our year out with called a needs assessment. Our title teachers and our reading teachers, we all worked together, and they quantified more than just the FastBridge. They also did some digging into different types of testing to get a better read on it. And we started out the year working on our ELA strategies, mainly with phonics. So we took the FastBridge test. I think we had about a 95% rate. We had some kids still out with some quarantining and so on and so forth. So this is what our scores look like, and we want to definitely increase our low risk, the yellow, and increase our green, the college pathway. So you can see that the biggest area we have is our some risk. So what we're doing right now is we're digging in to who the students are and what we can do universally in small group. And then we also have a time called WIN, which is what I need. But that does not replace that universal instruction, but it is a place where they can get some more intensified instruction based on the skills that they're missing that we've been able to identify. And then we're doing the same exact with the A math. And you can see that we have a little bigger gaps here with some of our math, and we know that. We're also working on that with our alignment and standards, and we're getting help from our CISAs to help us align our math. And same thing here, our goal is to get the yellow and the green boosted up and decrease the red and decrease the blue. So our teachers are working very, very hard in focusing in on a large group of students and then small groups and then even more intensified interventions.
Heather?
Yes.
When you're talking about this college pathway for 4th, 5th, 6th, 7th, how do you know that, I mean...
It's a score that they meet, that's what the FastBridge test quantifies it at that category.
Okay.
What was the time frame for this? Was this at the end of, was it spring of 20?
The time frame for this, we took this just this fall.
Oh, okay.
So we take it 3 times during the year. Everybody does. Fall, winter, and then spring. So we started the year out with the spring assessment, and now we just got this assessment in, and so now we're working through these details and working with our teams to help figure out the specific skills that we need to work on with our students.
Did you guys compare this to see how this was compared to spring?
Yes. Do we compare it to spring? We do. So we already have looked at, okay, so this year's 5th grade, what you're seeing here was our last year's 4th grade. So then we have that conversation about, what were some gaps that took place there? Was there a summer slide? There wasn't that big of a summer slide from what we can see. We just know that we're still behind the 8 ball from one, we know we moved into consolidation. So the relationships with our families, we're still trying to figure out some of those with our younger students. That's a big jump coming in as a 4th grade student. So we know that's something that we need to continue to work on. How do we welcome our families and have these young kids feel comfortable coming into a bigger school? And then the other aspect is obviously the pandemic. There was a big loss. And we're not dwelling on it, but it's a reality. And it not only bothers our families and our students and community, but our teachers take it to heart every single day. All right, so looking ahead, this is really district-wide. We're all looking at continued ELA work, our English language arts, and we are looking at the assessments, and the assessments can be through this FastBridge. It could be an ACT, Aspire, but there's also daily assessments that take place in the classrooms that our teachers assess students where they're at. They collaborate with their team. What's working in my class? What might not be working in your class? What could we do together to figure that out? Maybe you want to work with Wayne for a little while because maybe he's going to learn from you a little bit better. So we're constantly having those collaborative conversations. Universal math, we're continuing that. Like I said, we're starting with a standard alignment and just really thinking about what is that vertical alignment and what do our teachers need in order to help support the students at a rate of growth that we need them to be at. So what's that base level and then how do we extend it?
What's the vertical alignment mean?
Vertical alignment is going to be like 4th grade to 5th grade, 5th grade to 6th grade, 6th grade up. So right now, like our 612 was working a lot on standards, but the math standards were being developed, but they weren't focusing a lot on the math at the elementary in the middle. They were focusing it more on that 612. So now we're balancing that out. Systems of support. I mentioned title. The high school does have a title instructor that comes over part-time. That's first time this year, so that's a learning curve because you need to build a relationship, and a lot of it is based off of FastBridge and then helping with the interventions. At the middle school level and at the elementary, it's a little bit more intensified because we have them for a longer period of time. So we really count on our title and our coaches to help guide a lot of that intervention and strategies that we maybe need to beef up on and or learn in order to help our students. So that's an overall system, and then we also are aligning or have aligned. Amy helps organize that all with all the CISA and all the different coaches that we have. How do we ensure that we're all staying focused and not sending different messages? Because that does impact how students achieve. Okay? Any questions?
All right. So I'm going to introduce and talk to you a little bit more about AGR. So at the elementary, we have AGR. And so what AGR represents is Achievement Gap Reduction. It's a program that provides us the opportunity to implement from 3 different strategies. So the 3 choices of strategies that all of our elementaries could choose from are the one-to-one tutoring, the instructional coaching, and then maintaining that 18-to-1 or 30-to-2 student-to-teacher ratio. So some parts of our AGR planning. So we do our performance objectives. We create goals and try to align reducing the achievement gap between our low-income students and our students the same grade and subject statewide. We provide reviews and board information on our implementation and our progress toward achieving those goals. And then there's aid that's paid to our district that does provide support to cover that coaching or that small reduced class size. So as part of our system, looking at our AGR goals, we focus on reading and math. And in the past, we've looked at growth rates. This year, we are focusing on our proficiency rates as well as our growth rates. It has been a little difficult to identify when students make growth because sometimes they may not be making growth from, say, high risk and moving all the way to the next category, but we still look at the growth that they are making. We also talk about the coaching and the class size reduction. Those are the 2 that we are using in our district. So at all 3 of the elementary schools, we have targeted grade level and individualized support by teachers. And then in some of our classrooms, we are doing the 18-to-1 ratio. So some additional information to consider. This is inclusive of all students. So regardless of socioeconomic status, the AGR qualifies us based on the low income, but this does provide support for all students. Also, 4K is not included, so this is just support for kindergarten through 3rd grade. And then as I mentioned, the 2 strategies that we are using are coaching and the 18-to-1. Some of the coaching that we are implementing, we have coaching through the Math Institute of Wisconsin. We had that last year as well as this year. And then literacy coaching, we have classroom environment coaching, coaching for our new teachers, and principals also receive coaching.
Okay, the next couple slides, these look somewhat similar to the slides that Amy went over with our district. Demographics, our elementary, you can see our enrollment numbers there, K through 3, and pretty even with our male-female population and our percentage of students receiving that have an IEP. And I know from experience that that number is going down as we are improving our systems of support at the elementary level, well, actually throughout the entire district. And our percentage of economically disadvantaged, 70% at the elementary level. EL is English learners, and then the homeless percentage. This goes, this is an interesting table because if you think back to consolidation, one of the goals was to provide similar system of support at each school. If you remember back, those of you that have a little bit more history on the board, you know, we had some rural schools that didn't have title services. Students were programming for some students with had certain disabilities were only at certain schools. Well, this is showing some evidence that not only with gender and student populations regarding disability status, very similar at each of the three schools. Maybe the only change or the only difference is socioeconomic, with East having a little less students that are qualifying for that economically disadvantaged status. And then you see the percentages pretty similar in EL and also with homeless. And then this slide shows our race and ethnicity breakdown in those different subgroups.
All right. So here is our data, and this is our reading data. As we said before, K1 takes what's called early reading, and that involves 4 subtests that do change throughout the year. And then our grades 2 and 3 take an A reading test, which is on the computer as well. And as we said before, we don't have a college pathway marker for the K1. I think if you can take a look at our kindergarten numbers right now in relation to what Joe was bringing up, we have very few high-risk students in kindergarten right now. And I think really what that says is that the things that we have put in place in 4K to provide that phonemic and phonological awareness, that sound and how you say it, is really working. And also, us being in person 4 days a week was huge. When you look at our data, and I know like West data really, really well. My West kindergarten data coming in last year off of the closure did not look like this. As you can see, our first grade numbers, we've got some more students there in high risk, and that's just really evident of them not getting their full pre-K experience, and it's something that we're now having to intervene pretty heavily with at those, K1, 2 levels right now, and even into 3rd grade. And then here is our math data. So same thing, K1 takes 3 different subtests throughout the year. That changes. And then our 2-3 does A math, which is on the computer. Again, we don't have the college pathway indicators for K1. Any questions on that data? So some of the things that we're continuing to do, as we said in the spring, we were sending those groups of teachers to that foundational literacy training. They came back really excited with the information that they learned and have implemented some of those strategies already, because they started like, this is what our kids need. Thank you for sending us. They're really excited about that work. We do have the continued math work, as you heard Clint and Heather say about the standards work. We're developing those essential standards in math. We have some coaching support. We have coaching like interventionists at all 3 levels as well this year. And then we also have the coaching that Donna had mentioned with the classroom environment, with the math, and with literacy from CESA 6.
So we just wanted to finish up because a complete picture of our continuous improvement plan. So you got a lot of data from all of our schools with regards to academics, but a huge piece of how we are trying to transform academics is also focusing our school conditions goals and then our leadership goals, because they have to work together in order for our students to make progress academically, socially, and emotionally in the school district. So the school conditions goal, just to remind you, it's to increase trust among all stakeholders by August 2024. We will build and implement a framework to transform our school community as measured yearly by the EE survey. You can go ahead. This is just some data to take a look at in comparison to the state, and I think that as you can see, so these were just 3 of the indicators based on the trust. So teacher trust in their principal, I feel fairly satisfied with my job, and I wouldn't want to work in any other school. Those were 3 areas that we looked at. We dropped, but not even as significantly as the state dropped. And so positive, negative, obviously we want to increase those scores, but the things that we're putting into place hopefully are going to continue to help improve that. Do you want to go?
Can you just
Yeah.
go back and clarify what that means?
Yeah.
What do the numbers mean?
So this is a survey that's given to the teachers. So 76% in our district this year said it's okay to discuss feelings, worries, and frustrations with the principal. So it's still a fairly high. 76% of our staff feel that. Last year it was 71%, or flip-flopped. Sorry, flip-flopped. And the state it was 77 and 84%. So that's what that means. Okay, and so one thing I wanted to say, even though we're using the EE survey in our main district goal, we also use, it's not just about teacher sense of trust, but our students and our families. And so as part of the work we're doing, students and families will also get a Vibrant Schools survey, and our staff this year as part of our grant work. And we also use YRBS data for our students. And we're also, and that's only 612, so we're also looking at ways to get feedback of sense of belonging of our students at the K-5 level and through 7th grade as well through different means so that we can really ramp up our student voice in that. And then our leadership goal, this is our 3rd prong, using a continuous improvement framework. We'll use data to inform our decision making and monitor our progress in the areas of communication and feedback throughout the system is measured by, again, the EE survey as well as the district capacity assessment, which is just in general what we do every year, our leadership team, to see what our systems are looking like. So from a whole systems perspective. But this is just some data. It's the same type of comparison to the state. We did increase in a couple of areas, even when the state went down. And this is usefulness of feedback, informing our practice, accuracy of the feedback, and then different evaluators would give the same ratings. And one thing I wanted to connect, there's a interesting research article that Dr. Sprague shared with us, but also is on from Madison Middle School, and it's just preliminary data, but it's showing the connection between student sense of belonging and teachers' belief in their efficacy, meaning they went, and it was in math, middle school math. And when teachers felt that they were good at teaching math, their students also, they found, had a greater sense of belonging. So it ties, it's giving some good data about how we can then tie teacher practice and teacher efficacy to their sense of belonging as well. So just a tidbit I wanted to throw out there.
One thing about the EE survey, and I know you have those results linked in your data, 2 years ago when we did our baseline data, we almost tripled the number of staff who actually took that last year. So our baseline population really grew because they knew we were using a lot of that to measure some of our goals, and we emphasized that a lot more last spring. Plus the spring before we were in closure, so that was a little hard to rally troops to get that done. So we have a bigger baseline now as well in our reporting out of that data. All right, any other questions or thoughts, wonders?
How similar were the reading scores between schools? Pretty similar, or were they, and between elementary schools?
You know, I can't answer that accurately at this moment. I've looked at all 3 separately, but we've been focusing so much on this report and the combined. There's some similarities and there's some differences. You know, like we started to recognize strands that were lacking, and not only as a system, but now we're able to even break them down by building. So as much as we want to be consistent, not everything is always the same. So we're recognizing maybe we need to give a little bit more here in this area for this school versus this area for this school. But I can't speak to that very eloquently right now.
Amy,
when are you planning on giving us the next set of data?
That'll be in January.
Would you also include this so we can look at the comparison for this?
Some longitudinal data?
Yep.
Sure.
For this year, because somebody mentioned about the previous years, so that would be last year's 4th grade versus 5th grade. So if that's the case, at least we can compare and see the growth in those same classes.
Yeah, we can do that.
Sounds good. Thank you.
I know this is a lot of information, so if ever there's time where you're wondering about something even ahead of time or afterwards, don't hesitate to reach out and ask me questions. I can help field those. So thank you for your time.
Thank you very
And
much.
thanks to our principals for doing a lot of the hard work this year and putting this together. So thank you.
If I could just add, at CISA on Friday, a point of discussion among superintendents was how long it takes to change data to show improvement. So I always start to sweat a little bit when that conversation comes up, and 5 to 10 years, and I think, okay, this is year 4 for me in this position. So what do? Subtract the pandemic time? We don't want to do that. I love what Heather said. Heather, what did you say? We own it, or we recognize it, but then we want to move past it. It is what it is. So I just kudos to all of you and our staff, because this is such hard work. And when Rachel said staff really take the scores to heart and they want to do their very best for our kids, we do see that daily. So I'm proud of all of you.
Okay, then we will go on to item D, third Friday enrollment report.
Andy, this is one you saw at the last meeting. And so what's important for board members to know is Stephanie Parker and Mary Kay, first of all, produced this report. But DPI has very strict guidelines on how we count students. So students need to be in attendance prior to the date of the count and 1 day after the date of the count. So the preliminary information that we gave you at the last meeting, we have verified. So this is the enrollment data that we are submitting, and you can see it by school. And essentially from the previous report, we were down 3 students at the middle school, 3 students at the high school, and down 1 student in 4K. And then Mary Kay wasn't able to verify, I believe it was 13 students with open enrollment, where they may have been either chose to go to Homer, or they had said they registered with a particular school, but in fact they didn't show any progress or any attendance. So we had a total of 2,167 students attending the district, up 41 students from the previous third Friday enrollment count.
Okay. Any questions there? Okay. We will go on to item E, budget calendar 2022-2023.
Andy, this is just a document that I use to try to organize my activity with when we're coming to the board with various topics. So it's just a guideline to show the board where we're going with reports and my activity throughout the year. Just an FYI.
Okay, and I think you present this to us every year. Any questions about it? Okay, we'll go on to item F, tax levy discussion.
Okay, this one is one where I wish this meeting was postponed for another 4 days, because there are a tremendous amount of unknowns. And but I've worked pretty hard at giving you the most accurate estimate that I can. And I've used last year's equalization aid worksheet. So I know what Anago spent last year, but I don't know what the other 420 school districts spent. And if you're familiar with that, I don't want to get into the details, but there are things like guaranteed cost ceilings and where everybody went with relationship to whether they increased in property value or decreased in property value. But we're going to know by Friday whether we're going to get aids and what those aids are going to be for Anago. And I'm thinking in my estimate, we're probably within, if we look at the mill rate, we'll be within 25 cents either side of my estimate. So the first document there, you don't need to open it up. That's what I received from the Department of Revenue. And so the fall equalization aid values is what I received from the Department of Revenue. And then if you can go ahead and open up the preliminary tax levy number. And what's important for the board to understand, let me just get mine open here. Is if we go to the bottom, the number, it's all going to be relative. At this point, I'm saying that taxes will go down. And what's important is the levy is going to go down. So the actual amount we're going to tax is going to go down. If you look at the first column, we've got the municipalities. There's 19 different municipalities within the school district. The next is the equalization value for each municipality. And my understanding is the equalization value is looking primarily at the change in value of home sales from one year to the next. And what's important is this is based on 2020 values. So we're already 10 months later. So the economic activity of the prior year is really what we're looking at. And then in the next column, you can see, like if you look at the city of Anago, their equalized value actually went down $13 million. And then you can see in the percentage of the total, the city of Anago represents almost 31% of the district's equalized value. Its equalized value as a percentage of prior year went down 3.42%. And using my numbers and plugging it into the formula of guessing at the state aid, you can see the proposed tax levy, the preliminary tax levy, and then you can see the difference that the city of Anago residents are going to see in their levy. And then you can see the percentage that it's going to go down. What's important for the board to know is across the whole district, we had a low of a negative 4.2% to a high of 7.5%. So even if we say the mill rate is going to be 691 or 7.25, that's the average. Across each municipality, it's going to be different. And we'll know those numbers on Friday. Why I want to bring this to you now is to put in your mind the idea of increasing the levy for the Community Service Fund. Over the course of the last probably 8 years, we've just had some tremendous donors support the pool. And they do that every year, and we're able to keep our admissions low, and our attendance over COVID has been highly impacted. And we've done everything from replace the whole heating and ventilating system in that building. We've replaced the pool heaters. We've replastered both pools. And now we're working on replacing the sand filters and all the disinfection equipment within the pool. And I submitted a budget to you that shows that we're going to be pulling it was a planned expenditure. We're going to be pulling $205,000 out of the fund to put that new capital equipment in. And I just think it's important that as a community we support that, and we can do that by increasing, and I'm going to suggest if in fact the aids come in where I think they're going to come in, that we increase the levy from $270,000 to $300,000. And that'll represent an increase in the mill rate of about 2.5 cents. So we're talking about $2.50 on a $100,000 home. So it's not a significant jump, but it's one that I'll be asking if the state aids come in where I think they will. It seems like a very reasonable thing to do. So questions?
So we just approve that, right? It's not like a referendum or anything?
So what we do is I'll provide some detail about, so we have a couple things. We take the levy for the Revenue Limit Authority, which is Fund 10. We have our last debt payment, which is in Fund 38. That comes off the top of that Revenue Limit Authority. The Fund 80 levy will be a separate item that, I think this year I'd like to propose a number to you, and you can amend it or do whatever you want to do with it. So you vote on that every year.
Okay, any other questions? Okay.
Tim.
We'll go on to possible action items. A is consideration to approve replacement of classroom projectors.
Hi, thanks for making this an action item. I know the COW meetings aren't always for action, but the way electronics have been the last couple of years with all the parts coming and going, the quicker we get things ordered electronically, the quicker we get them in. So that's why I'm asking you to try and, if you would wish to approve
Mark,
it tonight, so I can get them ordered.
Put your
tomorrow.
microphone up.
I'm sorry.
Thank you.
Just to try and get the electronics ordered as soon as we possibly can because of the length of time it takes them to come in. And that's one of the reasons I would like you to accept the little bit higher bid. It's only like $4 per unit because that vendor said they had them in stock and they'd be able to get them to us so that we could take advantage of that newer technology a little bit quicker.
Okay.
I'll move to make a motion that we approve the bid, and it looks like, are we doing B&H?
Tierney Brothers. the
Tierney
31
Brothers.
For 21,000,
I think.
yeah, I was looking at the quantity.
Oh, okay.
Okay, for $21,484.
I'll second that.
And that's 20 projectors.
Yes.
Any further discussion on that?
He answered the question I had, is if the company had them in stock, because that would be a tough thing to get that many of at one time.
Right.
So that's good.
Mm-hmm. Yes, it is very good that they can get one.
Thanks, Mark, for checking that.
No problem.
Anything else? And we'll do a roll call vote.
Newfeld,
Yes.
Hyatt,
Yes.
Schrader,
Yes.
Zimmerman,
Yes.
Bardo,
Yes.
Deep,
Yes.
Gagnon,
Yes.
Maddock Nelson,
Yes.
Mary,
Yes.
Thank you very much. I appreciate it.
Thank you.
Thanks, Mark.
And we'll go on to item B, the first reading of NEOLA Volume 30, Number 2, Non-Discrimination Policies and Policies 5460 and 7250.
I move the board approve the first reading of NEOLA Volume 20, Number 2, Non-Discrimination Policies and Policies 5460 and 7250.
I'll second.
Okay. Any questions on these? It was a fair amount of reading.
It was good reading on a Saturday night, that's for sure. And prepare for the sermon, yeah. There is just a couple of things that I did come across. On these. I don't know. Do you want us to talk about what we come across, or do we email them? What? I know we're only at the first reading.
Yeah, we're at the first reading, and I think it's appropriate if you would email questions in advance. But here that we're here tonight, let's talk about them.
So the one of them that I had was the conduct in virtual classrooms. Julie, does that cover that list A to H? That would be 5500.01.
Okay.
New policy, volume 30, number 2.
What was that number again? 55?
5500.01. There's a list of A through H, but is that all inclusive, or can we add to that if somebody in the administration says that there's something else that needs to be put in there? Or is this what NEOLA recommends only? Or was there anything that came up from the years of virtual learning that was not included on that list?
So it is, I still didn't find it, Danny, but this is NEOLA's list, but what they do, Tim Bannock thank you, is our representative. So he meets with Mary Kay and me, and he walks us through these. So when there are options, we bring those to you.
Okay.
So,
I know down at the bottom it has the last three that are just blank, I, J, K, and I didn't know if there's, you know, did all the administration see this to where they can add anything to it?
no, but if they don't all work in policy, but if we have
Okay.
questions or need feedback, we reach out.
See, I don't know if there is something, because I don't, with not dealing with the virtual classrooms and what things go there. This is under the tab policies for board 30-2, and then if you scroll down to policy number 5500.01, conduct in virtual classroom, that's where I'm at.
It is a brand-new policy.
Yeah, that's what really caught my attention, because you had checked, or you had something on that brand-new policy, so I was just curious as to if that is all-inclusive, so we don't have to come back and revisit this at a later date.
Right. I would say we would not. That list of, now Andy shared it with me, that list recommended, you know, NEOLA works with a lot of attorneys.
Yes, they do.
So in their recommendation, that would be an exhaustive list that would cover, you know, hopefully anything that could happen.
All right, and then when I look at, hold one second, it's policy volume 30, number 2, 5880, public performance by students. I'm sounding like Mike Boldig here, because Mike always read all these policies word for word. Let me go to it myself. Okay, here it is. Under that same tab, policy number 5800, I see that it's stricken. Parental permission for each minor is sought prior to the performance. So if there's a performance off-site of school, we don't need parental permission anymore. Is that what NEOLA is saying, or is that something that we chose to strike? It would be letter C under, yeah.
That's a good question. If I read it very literally, like I'm going back to my teaching days. So last time we held public performances, we had them at the high school, our elementary students. And so then that student was bused. So I am, again, making an assumption that the teachers would know which students, you know, were not able to go. And if it's an evening performance, that permission would almost have to be given by whether the student attends or not. I think it's safe to say we can communicate that clearly, but if the board would feel better with that in there, we could certainly add letter C.
Don't we currently have where we get permission slips sent out to students before any transportation? So if we add that back in, that's going to
be a double.
Will it be a double, or is this going to replace something else in the policy in another place?
Mary Kay, was this NEOLA's recommendation that be taken out?
I'd have to go through my notes. The binder.
And it might be because it's under whatever field trip or leaving school property, you know, it might be governed there, and that could be the recommendation, but we'll check on that.
Okay.
So that we can bring it back.
And then same section. I only got through this first section. 6152.01. 6152.01, the waiver of school fees or fines. So when I go down to procedures for resolution of disputes, on item letter E, we have the X by the decision of the district administrator as final, and then under that, stricken is or an appeal of the district administrator's decision must be made to the board within 7 calendar days, etc. Again, was that NEOLA's recommendation to strike that appeal, that if a family did not like the yes or no from the district administrator, then that's it. A person can't appeal to the school board.
No, I think that was our decision. In the 4 years I've been here, we've not had any appeals because we
Right.
so willingly waive fees.
Right.
And
I'm glad we do.
yeah,
Yeah.
and we do want to come back later this school year with a fee proposal that vastly reduces them again.
Right.
So I felt comfortable that we would not need an appeal process because you saw our demographics tonight, and we don't want fees to stand in the way of any student accessing any extracurricular or club or trip.
Right.
With the exception of like a booster fundraise trip. So
Yeah,
I felt comfortable that wouldn't be necessary.
I do get that. However, in the event 50 years down the road that you're no longer the administrator, we're no longer on the board.
Hope not.
Right. Wayne, are you saying that for you or me or?
All of us collectively.
Yeah, collectively. I feel like that it's in the best interest that we include that because that always gives an option of always appealing to the board. I mean, just like a student expulsion, if the parents and students don't like the decision by the board, they can always appeal to DPI. There's always somebody that they can go to. And I commend you for, being very lenient and working very well with our demographics that we have to work with. However, I just feel like that should be in there. I don't know, it's the decision of the board. And then the last one that I had was under the food service. When I saw this Saturday, Sarah hadn't had a chance to look at it. Has she looked at it since? 8,500. The food service, it says check with Sarah DeBoer. And has she had a chance to?
I haven't heard back.
Yeah.
So I'll connect with her.
Okay. I'm sorry, I didn't.
Did you have something specific?
No, I did not, because when I saw that Sarah hadn't even looked at it, I couldn't see what her recommendation was for which option for the answers to the questions that are in there. And I didn't get to 30-2, the non-discrimination. Sorry, Mike, I let you down. I didn't get them all.
Okay, thank you, Danny. Anybody else have anything? Okay, so these will come back after the, still got a little work here. Okay, we can go on to item C, report of employee resignations and retirements.
I move the board accept the resignation of Kelly Spencer, instructional assistant, East Elementary.
Second.
Any questions or concerns? Then all those in favor?
Aye.
Any opposed? Okay. And report of district new hires.
I move the board approve the following new hires. Louisa Berg, translator interpreter. Bryce Gonzalez, EL instructional assistant.
Second.
Okay, any discussion on these? And then Mary Kay, we do a roll call.
Hyatt,
Yes.
Schrader,
Yes.
Zimmerman,
Yes.
Bardo,
Yes.
Deep,
Yes.
Gagnon,
Yes.
Maddock Nelson,
Yes.
Newfeld,
Yes.
Mary,
Yes. And then we'll just confirm that the next meeting is Tuesday, November 16th. That is, yeah, the week before our Thanksgiving break. Is that correct?
So we're gonna have one.
Yeah, well, that's a good question. What do we got scheduled? Because would there normally be a meeting during Thanksgiving break? Or,
I mean, not since I've been here.
so do we have,
Why would that be on the third Tuesday?
yeah, it's the third Tuesday. Why is that?
Oh,
Should be the 9th.
yeah,
Should be
should
the
be the
9th.
9th.
And is the regular board meeting in November, I know,
That
we'll-
would be the 23rd, right?
The 23rd.
And a second meeting in December hits the break also.
yeah. So we could just discuss that a little bit right now. Would people like to change that so that meeting is not, that neither of those meetings are in break
I
period?
remember in June, when we had one meeting, we went on the third one of the month to give the
Yeah.
administration a little more time to get ready, or was it July? Okay, I'm sorry.
Yeah.
Or I gave them an extra week when we only had one meeting in that month.
I guess I'm not suggesting that we have only one meeting for these months. I'm just suggesting that we move that second one so it's not during the break.
Tim, would that pose any problems for the business office? Tim?
Because it is the holiday, we'll get them out.
Yeah.
We can make it work. It's going to be a short month, and people understand that. We may have to do more special checks in January as a result. And I can put, if there's anything that's really out of the ordinary, I can put that in the review.
Okay. Okay, and you can think about this for a week or two because we're just going to approve that the next meeting will be November 9th.
Right.
And then we can have a motion to adjourn.
Andy?
I have one
And,
question.
and I have a question too. We're already starting to get emails, just so you know. And I do not know this person. I know nothing about this person. But she is asserting that we will get $3,000 more per student in federal money if we mask our children. So I'm just telling you, that just came in. And I also was questioned, was a deal made with HHS for extra CARES money per child that comes with a mask rule? Anything with that? Because that's going out through the community. Okay,
Dave, did they
good.
cite where that came from?
No.
Oh.
Well, there was somebody that said something previously. I think that reference is, if
I just
not-
don't want the people
Right.
out there to
No.
think that we did this.
No, I
get
think
more
Dave,
money.
where this comes from
So
is,
we need,
the president said something
Well,
about if
because
if
they're gonna
certain
believe
states,
what they
the
want.
governors
right, they're gonna
do
believe what
not
they wanna believe.
fund those districts or cut their reimbursements from the state, they would be made whole by the federal government.
Demonstrate
So,
going to.
thank you, Tim. Well, I didn't believe it, but I thought we should let everybody know that's what's out there.
Andy, the one question that I had that I'm glad Tim hasn't left yet because he can help shed some light on it. We all got the email of the staff member that quarantined, exhausted all of this sick days. I know that we've heard that there's no money to pay staff whenever they're quarantined for various reasons. Is there anything that we can talk about this to help these? I know they can make up some time somewhere down the road, but most people, our demographics tell us, we live paycheck to paycheck, and whenever the
I met
paychecks.
with her today.
Thank you.
Because I would, it tugged at my heartstrings too. So she was given the opportunity, at least a day and a half, I would say, that she was able to work from home. So we just want to make sure that we're doing what we can. But to send a blanket statement like we did when that closure was imposed upon us, nobody had a choice then. Now there is some choice. I think, hopefully masking will help the decision here tonight because she wouldn't have to quarantine if she's asymptomatic.
Right, right.
So that should help. And I just wanted to make sure that she understood if there was a workload that she could accomplish, she could work that out with her supervisor.
Okay.
But we didn't put it out like we did 2 years ago to say everyone is paid no matter what, because we still have some certified staff who, if they are quarantined and asymptomatic, but they have a little one at home, they're choosing not to teach. And so then they take a sick day as well. So it really depends on the situation. But
I'm not
tonight
saying to
should-
pay, carte blanche if somebody's gone. I'm just saying if somebody is quarantined per our school policy, that is there something that we can do to help that person to be able to recoup? God forbid this teacher or staff person get sick somewhere else in the latter part of the year, and she has 0 sick days to help her out. If there's a plan that Tim's mind that's so full of a lot of numbers.
And we do have a sick leave bank for just what
Yep.
you described. It's been
Okay.
accessed probably 3 or 4 times since
Okay.
I've been here. And we didn't have that in my last district. I think it's an unbelievable program that the staff chooses to contribute to so that if they need to access it,
Right.
they can.
Put it in perspective too with the situation when we support staff like instructional assistants, students were also home. And so they had work to do from home. Now it's difficult because sometimes the staff are home, but the students are at school. And there's no work for a support staff to do. And so that's the dilemma that we run into. She was able to work last week because students were also home. So we did make that accommodation so that she could work virtually with
Right.
students. So that's where we're getting into. It's not that we don't want to.
Right.
It's just.
I don't think anybody wants to not pay and take care of our staff. I mean, we know how hard that everybody works from you and your role all the way to whatever we want to go to. But
I'm very hopeful tonight's
Yeah.
decision will help.
Years ago when I was teaching, they had, teachers got so many sick days, and if you didn't use them, you could put them in the bank and somebody else could use them. I couldn't hear what you said, I'm sorry, Mike. I don't know.
So has this person asked for sick days from the bank?
No.
But they could.
But those would be for the
No,
future.
these are for quarantine purposes, not for personal sick time.
Yeah.
Yeah.
Because she's exhausted all of her sick days because she has been quarantined because
Yes.
of close
Yeah.
contact. So now if she gets sick, can she pull from that
She
sick
can
bank?
pull from the bank.
Possibly.
Yeah.
Okay.
Does she knows about that? I hope, yeah.
Well, we have to, procedurally, when we talk about that, because right now, it's considered grave illness.
Oh,
To draw from the bank.
draw from.
Oh, yeah, it's like cancer.
There's a catch.
Yeah.
Yep.
For yourself, but that's where we ran into problems. We had people borrowing. I gave all my extra sick days every single year, and they were borrowing it for maternity leave, and it was supposed to, your days were supposed to have been paid back as you were able to pay them back. These girls were having every other year they were having a baby, and they were drawing out of the sick bank. Who is in charge of the sick bank? I mean, who oversees that, Julie?
HR
Okay.
and the business
Because that-
office
yeah,
together.
Because it was abused.
Did we
Yeah.
have a?
It's
Yeah.
Andy?
I think the
Andy, I'm
context
sorry.
of
I'll
that
make the
was
motion to adjourn.
Thank
I'll
you.
second
Second
that.
All those in favor of adjourning?
Aye.
When I see 22% leaving, I was
I
like,
say
maybe it's nice.
Beat me to it.
You were ready to say it
It's all
too, huh?
interesting stuff, but we're done, yeah.
Patrick's email.